Welcome to Labcast, a podcast about the medical laboratory science profession, brought to you by MedLabConvo. To get notified once we drop an episode, you can do well to subscribe to all our social media platforms at MedLabConvo. For questions, feedbacks, and shoutouts, you can do well to send a mail to at medlabconvolabcast@gmail.com. Thank you for listening.
Let's be honest, the healthcare battlefield is real. We talk a lot about collaboration in healthcare, but do we really practice it? Doctors, nurses, medical laboratory scientists, pharmacists, physiotherapists, and all allied care professionals, each of us play an important role. Yet sometimes it appears as though we are fighting ourselves more than we are fighting for our patients. Well, welcome to Labcast. I am your host, Bani Mesoma, joined by my co-host, Oluwada Milola. All right, let's talk about the One Health approach and how we as healthcare professionals can contribute to better health outcomes for patients. How do we break down barriers and build stronger interdisciplinary teams? What does true collaboration look like in practice? And why does it even matter? To unpack this, we have an incredible panel. We have Success David, a pharmacist actively involved in malaria advocacy. And we also have Dr. Brambifa Shaling, a BA. Welcome to this show.
Thank you very much.
Thank you very much.
Welcome once again, our guest. So, just like my co-host mentioned, we'll be talking about the problem with collaborating with other healthcare professionals, and we're glad that we have a variety of healthcare professionals with us. So, before we address the problem, we must ask ourselves what is the origin of the problem. So, where do you think this professional divide comes from? Why do we feel doctors are better than nurses or pharmacists are better than physiotherapists and all of those, you know, indecisions and disrespect and conflict comes from? Where do we think the problem started?
Thank you very much for the question. I believe the issue or the problem, the conflict of healthcare professionals started right from school doing the training. Because, while in school, we don't have that opportunity to collaborate with one another. And the fact that everybody or each profession feels that in their own mind, they are much more important than the other. For instance, in my own school, I school in University of Nigeria and Nsukka, and we have two campuses, the Nsukka campus and the Enugu campus. So for we the pharmacists, we only have the medical, that's the pharmacy department in the Nsukka campus, and that's actually gave us that mindset of, okay, we are the only health professional in this campus. This mentality of I've arrived and we are the doings, you get. So this problem of medical practitioners or healthcare professionals, I believe, started right in school, whereby everybody believe or have their own perception that they are more than the other, because there is no opportunity for collaboration. There is no opportunity for coming together, to have, like, oh, for instance, let me say, like a conference per se that will bring different health practitioners together to come, everybody share ideas. There is no provision for that. And so everybody is just on their own, feeling that they are more important than the other. So for me, I believe this whole fight issue whatsoever among health professionals started right from school. Thank you very much.
So, you're saying it's a grassroots problem. Thank you. Dr. Charlene, would you like
Yeah.
to add to this?
Okay, thank you very much. I think I want to agree with her that it all started right from undergraduate days. However, if you want to be more specific to when exactly did it start, I don't think anybody can actually pinpoint and say, oh, maybe it was in the early 90s it started. I wonder when it exactly started because on several occasions, I've even got to discuss with my colleagues, and we get to ask ourselves, okay, where exactly do you think this thing started from? And nobody can actually point a finger at it. Because I would say, if you ask me, where did it start from or when, I would say, I don't know where it started from. I just came and met it. And the point at which you meet it is in the medical school. You don't need to start practicing. So that's why I agree with her to an extent. And then I think part of the idea stems from the fact that some disciplines are considered inferior to others, which was a point she also made, and then I think if we try to look at it in a different light and realize that, okay, every discipline has a role to play in the healthcare system or sector or in patient management overall. Even the people that are not even found in medical school, for instance, the cleaners, they have their own role to play. And if these people are not functional, these other professionals, the doctors, nurses, pharmacists, they won't even be able to function. So I think it all stems from the fact that everyone feels they are more superior or more important. And then when you have that mentality from school, and usually that mentality is not just imposed, it just doesn't come from like when you go to school. I think sometimes it is imposed on students by the older colleagues who come to teach them. Maybe they create scenarios that happen in practice in the work environment, and then as a student you have your mind is streamlined to think that, oh, this profession thinks they are superior to us, or this other one think we are inferior, or we think we're inferior, and then there's now a preconceived notion to want to step up if you're the profession considered inferior, or to want to step on others' toes if you're the profession considered superior. So I want to believe it is something developed in medical school. Apart from the fact that she said it's within the student, I think the older colleagues, the lecturers, also have a role to play in imposing this will I say mindset into the student at the undergraduate level. Thank you.
Honestly, Dr. Charlie, I believe I quite agree that this issue is institutional, because even while I was in school, I can recall instances of senior colleagues or even lecturers, in different departments, instigating these stereotypes, these bias that you are either superior or the other person is trying to step on you, and you need to stand your you need to stand your ground. So our senior colleagues, the ones up there, also contribute to the fight, the power tussle that we're experiencing presently. So that leads me to ask, aside the things that we've mentioned so far, what are the other factors that contribute to this problem, this lack of collaboration that we often notice in clinical settings?
I think another thing that I have noticed from clinical practice, apart from the mindset that is developed right from school, is the environment we find ourselves may not necessarily be enabling for people to carry out their full potentials or the full potential of their specialties or their professions. When you try to see how medicine is practiced in some advanced part of the world as opposed to our environment, Nigeria, you get to find out that it's not just the doctors that have a role to play in the patient input. You see that other specialties come in. For instance, you get to find out that the pharmacists are involved in ward rounds. So ward rounds, when we go around to see patients. But in this our environment, let me say pharmacists, for instance, are involved in ward rounds. Dietitians have a role to play in the rounds. However, in this our environment, you get to find out that ward rounds, it's a doctor thing. Now, I'm speaking from practice, it's not hearsay. I've worked in facilities where ward rounds are just a doctor activity. You don't get to see any other healthcare professionals. So when you come to the patient's bedside, you want to find out what has been done for the patient. How is the improvement? Is there a new problem? What do you think you can do to help or improve the patient's the patient's well-being, so to say. And then you get to see that if it's a facility where it's mostly a doctor activity, which is what we find mostly in our environment, because I've worked in different facilities in different parts of Nigeria. you get to see that, of course, it's just the people in the ward round that get to have an input, and that's the doctors. They choose what is best for the patient. But then, in an environment where things are working adequately, the nurses should have an input. The pharmacist should have an input in the choice of drugs. It should be a collaboration of different professionals rubbing minds together to find the best solution for the patient. Now, in the facility I currently work in, nurses are sometimes, emphasis on sometimes, part of the ward round. When the doctors come to start the ward round, we usually call, oh, come, let's start the ward round. You get to find nurses coming, and then sometimes their inputs are taken in the patient's care. You get to ask, oh, you're the one with the patient here. How do you think, for instance, the wound is? How much food do you think this patient should take? And that helps because the nurses spend more time with the patients on the ward as opposed to the doctors. But I've never had a ward round where there's a pharmacist in, where their input is needed, or a dietitian is in. Do you understand? So I think the environment may not necessarily be enabling for the optimal collaboration between these specialties to take place. What the least or the most times the communication between the doctor and the pharmacist in most parts of our environment here is the prescription that links them, and then the doctor doesn't get to see give the pharmacist the prescription. It's the patient. So you may not have a direct link with the pharmacist. So there are some gaps that need to be filled. Thank you.
Exactly. There's usually a disconnect. But what you just mentioned, do you think that it is perhaps linked to the evolution of medicine in Nigeria? Because, I mean, before Western influence, Western colonization, we were more reliant on traditional medicine, right? Before some mission hospitals and some hospitals like University College Hospital Ibadan were established, where the first set of medical doctors were trained. So it's more like a firstborn thing. So doctors were the first ones, to how do I put it now? When it comes to orthodox medicine, they are the champions in quotes of orthodox medicine in Nigeria. Do you think this is perhaps related to that attitude that we still notice in the workplace, where sometimes doctors want to keep patient record, they want to keep patient care? From sources, would you like to contribute to that?
Okay, I wouldn't say if that would be the reason, because even if they are the firstborn child, I also believe that confidence, you may be the firstborn child of your parents, and then you have other younger siblings, and that does not mean you don't associate or communicate effectively with them. So being a firstborn, or being the person that was trained during the time the orthodox medicine was introduced, does not mean that you should now become the alpha and omega of it. You get, it should also give us the opportunity to contribute and bring other people into the say, like what my colleague, what the doctor said, and she perfectly mentioned what is really happening in clinical setting. When it comes to communication, there is a lot of, like, there is bridge in communication. And then I'm speaking from the perspective of as a pharmacist, doing my internship in University College Hospital Ibadan. I did my internship there, and our only way to communicate was when the prescription gets to us, and we would now see. And the fact that there are, I think that when a doctor should be clerking a patient, they should be like, apart from a nurse, they should be like a pharmacist there doing the clerking. You get, and also the whole trying to diagnose or whatsoever, to know the right drug to give to this patient. Because we when we get this prescription on our decks, we as the custodian of drugs, we see there are some, we of course we know there are some drug interaction and all. Sometimes we have to pen down a note to a doctor, like, please, sir, review this should not happen and all. And you get to see that the doctor imposes and or tell the patient that please they should dispense that. And When you are sending a patient back and forth, going, come back, it's as if we are like fighting, and that shouldn't be as it should if there is like an effective communication among us. And this effective communication, I also believe it can actually grow if there is something like a clinical meeting, not just for a particular profession, but everybody come in this clinical meeting, come and give your own input. What do you think about medicine? You from your own angle, what do you think? When everybody come together, give their own input, you come to a center, a place of, okay, this is what we are doing. We are working as a team. So, like I said, being the first born, or being the person that was instituted during the time medicine was introduced, or orthodox, does not give one the opportunity to take it over like it should just be you. No, we are all working together as health professionals, to improve health outcome. And again, trying to also contribute to the question you were saying, she answered environmental factors also contributes. I think political influence also contributes, and again, I think I admire the medical doctors, their body are very strong when it comes to political decisions. When it comes to politics, you see mostly the doctors, but you really see other health professionals in politics. And it's crazy because when the doctors are there in the helm of affairs, they try as much as possible to make decisions that will favor their own people, you get. So I also believe the political parts also help influence this fight we are having between health professionals, whereby a particular health profession is found mostly in the political aspect and influences or maybe favor their own people more than the others. So that is just what I want to say about that. Thank you very much.
Thank you very much, Farm Success. I also wanted to contribute to, this situation. It is alarming how much, importance is placed to one um healthcare professional over the other. I like the word confidence used. The fact that doctors see themselves as the champion, the firstborn of orthodox medicine. I would say that if there are no gaps that needed to be filled, these new fields, these other parts of healthcare profession, like the pharmacy, like nutrition and dietetics, like medical laboratory science, like physiotherapy, and you even mentioned as little as even the health information management system officers. If these gaps did not exist in the first place, I mean, these professions would not even have come up in the first place. So doctors definitely are incapable of doing everything to run the hospital on their own. And we appreciate how much they are doing to champion healthcare, but we have to create that room where we can accommodate and, respect each other and be able to do the best for our patients. And I would also like to say that Farm Success hits the nail on the head as regards the political influence that doctors have. I won't say that their body is strong. What I see is a sense of unity between them, that sense of superiority that every other professional has to have. We are all professionals in our own right. So nobody is superior or inferior to any other body. But the problem is when it comes to doctors, they are able to stand together as one and make the decision and fight for it. Medical laboratory scientists, let me speak based on my own profession, have a body as well. But if you're saying, okay, we're going to call a strike just to correct a particular policy or an error, you still see some people, because they have personal relationship with this doctor or something, flouting that particular solidarity action just for favorism. So I feel like every other profession as regards healthcare have to realize that we are not inferior in any way to doctors. We have our own rights as professionals and we have to stand by it. So it's a very elaborate conversation altogether, and there are very many angles we are open to explore in this conversation.
All right. Dami, thank you so much for that. So let's bring it down to personal experiences. Has anyone of us ever felt that your expertise was undervalued or overlooked? Does anyone have any experiences to share?
Okay, of course, yes, I have. I've had the experience while doing my internship and also while working here in the hospital here, because I remember when my my HOD, we had a meeting, and then he was saying, okay, that we need to start going for ward rounds, as a pharmacist trying to go, get files, case studies, review them and all. It was a welcomed development, and I was very happy and eager. So at some point, it was as if the whole discussion it was as if she just said it without no action. I have to ask him, sir, please, what's up with the word round? And I said, you understand this whole Dr. Kinney fight and all, we are still fighting to see that. I said, fighting. Like, should we actually be fighting as professionals? For goodness sake, why should a fight even come into this discussion? We are fighting to see that we are being accommodated to get into word rounds. And apart from that, actually, it's very crazy that we have to fight in to get into this. And the reason why most of us go to the hospital, when I wanted to do my internship, I wanted a hospital practice just because of the fact I felt like, okay, in the hospital, I will have so many, knowledge, try to have access to patients, go for ward round, clinical presentation. But to be honest, I never had any of those experiences. I never had it. My job was just to dispense drugs, just to dispense, and it ended with just dispensing drugs. So any other extra effort you are making, it is on your own. You are just trying to read to know what's up, or one or two things about. So all these things you are saying, all these host fights, is not like I've not like. Okay, another scenario is that when it comes to decision making, it's, for my profession, we are being left out. For instance, as far we know the introduction of NHIS trying to make like paying 10% for patients. And we see in a situation whereby we, the pharmacists, are not even or incorporated in the decision making or trying to set out price for this NHIS, whatever percentage. They just come and give us the list and tell us that this is the list of the NHIS and this is it. And you will see the fact that what the NHIS are trying to cover is lesser than the amount we even purchase the drug. So who is going to cover the cost? And as such, we end up telling our patient that we don't have these drugs, whereas we have it, just because we can't sell it at a lower price than we bought it. So this as such is affecting our effectiveness in delivering healthcare to patients. And as such, we can't really do anything. So all these experiences are things that when I see it, I told myself that success after this moment, I don't think I can go to hospital, like to practice, to become a hospital pharmacist. No, it's not something I
It's
envision,
not
because
something I need
I
to
think hospital even have so much fights going on there than outside. It's a lot.
It's
So
a
let
lot.
let me not just go for that. But there is a lot of fights going on in the in hospital setting, honestly.
Some success. I want to say don't give up yet, but then I will leave that decision to you. Anyway, this just emphasizes the saying that when two elephants are struggling, or in these cases, I don't know how many elephants are struggling, it is the grass that suffers. So at the end of the day, the patient is the person bearing the hardest brunt of our power tussles of all our bad decisions. So it's really concerning.
Okay. Firstly, I think I want to disagree with the fact that you guys said doctors are gatekeeping, like say patient information or jobs that hover around patient care. And I think I want to disagree. I think part of the reason why we have these issues with interdisciplinary collaboration is the fact that some professionals want to encroach in the job of others. And I think if things are clearly spelled out, it will be easier for people to carry out jobs that are meant for them without necessarily encroaching into the patient's work. For instance, in the facility where I work, I want to give an instance now. Citing an intravenous access is the doctor's work. However, if a patient has need for a new intravenous access and a nurse does that, I don't think as a doctor I would have any issues with a nurse reducing the workload that I have. But then I am genuinely asking for a pharmacist now that because she mentioned talking about being a clinical pharmacist. For a pharmacist, what is the role of the pharmacist in that's a clinical pharmacist, what's the role in the patient management? I'm asking that because, yeah, I mentioned earlier that it would be good to include the pharmacist in the ward rounds so their input is made. But I don't think when a doctor should just click, I don't think the doctor would just stop. Okay, when it comes to treatment, okay, pharmacist, what drug do you think you'd input? Because the history that you get in your clicking will determine what drug you want to give. So I think it would be more of a collaboration. The doctor already has in mind, oh, these are the drugs I want to administer to this patient. What are you good with this? Do you think there's any issue with this? And not necessarily the pharmacist saying, oh, when it comes to drug, just leave it. You understand? Because I feel that may be the reason. I'm not sure though, I'm just speculating. That may be the reason why the including the pharmacist in the ward round in her facility, like she mentioned, was now a problem, fighting to join the ward round, because I don't see why there should be a fight, just like you said. So maybe there was an overlapping, or there was an encroachment in someone's job in the proposal of joining the ward rounds, and that was why there were now some hitches in them being included in the ward rounds. But I think if things are clearly spelled out, that should not be an issue. Thank you.
With all due respect to, our beautiful doctors and the amazing job they do in patient healthcare, I feel if we're talking about, people, being involved in other people's jobs, doctors are champions of doing that. From my experience as a medical laboratory scientist, I am an hematologist specifically, and one of the things we do is to make sure that we have the right blood for the right patient. So we go through the whole cross-matching process. And there was this particular situation where we had a list of patients we were to prepare blood for. But because this doctor he works in an hematology clinic and he has access to the blood bank, just walks into the laboratory, picks a pint of blood for his so-called patient, checks the blood donors register to see if the person is a a genotype match for the person, and goes ahead to cross match the blood beside me when my job is to cross match and give you the result. So how do I react in that kind of situation? It is absolutely normal for me to get upset or probably just leave the whole cross matching process going. Well, if you can do it, just go ahead and take care of everybody. So when it comes to everybody understanding their responsibility, I feel like a lot of other healthcare professionals do. If to speak in Farm Successes like opinion to what she was trying to say, the fact that pharmacists want to be involved in ward rounds, I think there are 24 hours in a day. And after a doctor has gone ahead to clerk, done the ward round, this patient file should be accessible to the pharmacist as well to see the treatment that have been going on so far and make their inputs. But the question is, a doctor who is taking care of a patient and a pharmacist saying, this particular person with what I see, these drugs might not be a good fit. Is the doctor open enough to accept that he made a subtle decision and needs to make some changes? Or do they feel like, well, I've said it, I know what I did in school, I know what I've studied over the years, and I am going to go ahead with my own treatment? So it is it's a lot for us to learn as different healthcare professionals. But because of our time, we'll just go on to the next question, which is the one health approach. The idea behind the One Health approach is we all come together in connectedness. We collaborate with one another. And our aim basically is to sustainably balance and optimize our patient care. We have a together perspective as to how we can take care of our patients. And we know how important this is. Emerging infectious diseases like the COVID-19 that came up, coronavirus, and the likes. We have work as regards antimicrobial resistance, which involves the doctors, the pharmacists, the medical laboratory scientists, the chemists, the biochemists, and all of that. Food security, environmental health, and the One Health approach has a lot of importance. So, from I think I'll ask Dr. Charlene first. Why does this One Health approach why is it important, especially in a nation like Nigeria? Why do we think this One Health approach is important to us? Why do we need to start practicing the One Health approach?
Okay, I think the whole goal of the One Health approach is essentially for the benefit of the patient. Because I think the whole collaboration between healthcare professionals, it all boils down to what will benefit the patient. So in an environment like Nigeria, where number one, we have already established that there is a disparity or a disconnect between different professionals right from the days of their undergraduate level. And then secondly, there isn't an enabling environment to foster collaboration between healthcare professionals. I think the One Health approach is something that should be encouraged, should be included, should be practiced in the Nigerian health sector to improve patient outcome. So I think that that's the benefit, and especially why it should be included in our own environment. Thank you.
Well done, Dr. Chalin. I also wanted to briefly ask that collaboration is not a choice. It shouldn't be a choice. It's something we must do because in our various professions, we swear oaths to protect the patient. I'm talking about the ethical implications of our actions as healthcare professionals. We have the principle of non-maleficence, we have the principle of beneficence, which puts us under oath to always prioritize our patient's well-being and limit harm, which means at any point in time or at all points, we need to bear the patient in mind. We need to put the patient at the center of healthcare. So we've talked a lot about, the power struggles, but I want to ask now, what is the solution? How can we shift from this power tussle, this hierarchical problems to actually delivering patient centered care? Are there skills that healthcare professionals probably need to build to help them collaborate better with other professionals?
Okay, I think I'll start with saying, yes, you're right. It should not be an option. It is something that should and must be done to improve patient care. So I think one measure that can be taken, just like Success said earlier, is having meetings between the various professionals. She mentioned that earlier. I think when we meet, instead of talking, because most times what happens is the different professionals talk in isolation, talk about the doctors get to talk about the problems they face with the nurses, the pharmacists, and vice versa, and then nobody actually gets to hear all together. So having these meetings would address the issues, gaps will be filled. And then secondly, I think right from the right from undergraduate level, we should inculcate and cultivate the habit of learning interpersonal relationship. I think in school, ethics and etiquette kind of plays a role in the relationship you get to have with your colleagues at work. And then maybe emphasis should be laid on how to be accommodating for other people's inputs in the patient care in all professions. Nobody should be thought of, or nobody should be considered in isolation. You understand? So I think apart from using these approaches, another thing is it's an individualized or individualistic problem as well. Like the problem that Damilola talked about. I think the one about the hematologist coming to pick up blood. I don't think that's something every doctor would do. It may just be specific to that person. So character development, attitude in the workplace, all those things need to be practiced or need to be worked on for us to be able to collaborate and achieve this. Thank you.
All right, those are important points, Dr. Salin. From Success, would you like to contribute to that question?
Okay, actually, she just did justice to the question. Teamwork is very important because if as a pharmacist I come, I bring my own idea, you as a med lab scientist, you bring your own idea, all of us come up with an innovative solution to help, curtail or try to fight against a particular ailment. When we are working together in collaboration, coming up with ideas. We can come up with idea, go together, research on it, solve problems. Like the world will just be a better place, especially Nigeria. And then again, the leadership. If we have people that, they don't just don't lead, but rather they listen to their followers. You are not just the like I say, the alpha and omega of everything, trying to impose this is how it should be, this is what should be done and not. When you sit listening to others, even a cleaner can be in the meeting and give their own suggestion on how they think the things should be running, and you listen to it and incorporate it. I believe that those skills are very essential to ensure that, because all these things, what we are doing is to improve health outcomes. If we are not improving health outcomes, I don't see the reason why there should be a health professionals in the system from the instance. So if we come together, collaborate, effective communication as well, because I think the problem we have is the gap in communication. When we are not communicating effectively, everybody is just sitting at their own space, their own profession, trying to paint pictures of the doctors are the problem, the pharmacists are the issue, the med lab scientists are why the hospital is not moving. So if we come together, sit down, communicate effectively and efficiently, I believe we can, meet at a point, at a center where we can ensure that the whole reason why there are health professionals would be achieved, to ensure that this one health approach is actually something that we achieve at the end of the day. Thank you.
Okay, so I am of the opinion that leadership matters, and left to me, hospital policies go a long way in how the management of the hospital goes. I personally feel like the management of the hospital should not be in the hands of any of the healthcare professionals. I feel like if we had someone with a strong business mind and someone with another person with a good knowledge of medical law, these two people will be able to make policies and decisions that are more suitable for every healthcare professional. One of the reasons why we see this power tussle is the fact that most of the time, like it has come up in our conversation, that one particular profession is given the opportunity to lead the rest. And in that particular position, the first thing, there's always a sense of bias, which makes them to make preferable decisions for themselves over the rest of the hospital team. So, how can hospital policies, how can we do better in a way that we can support effective collaboration among healthcare professionals? I'm not sure if we've heard about the River State University teaching hospital situation where we have a conversation, was like a meeting between doctors and medical laboratory scientists, enforcing that medical laboratory scientists actually teach doctors what we do in the lab. Like literally teach doctors what we do in the lab and make sure that they are good at it. And anybody who refuses to comply should be ready to leave the organization. And you can imagine that kind of policy being put in place in a teaching hospital where every healthcare professional is supposed to work together for the sake of the patient. Doctors already have gone through a couple of years in their schooling. Medical laboratory scientists have gone in a couple of years in their schooling, coupled with experiences. Now, combining these two roles together to one healthcare professional because of a certain reason, which we do not know yet, has a lot of effect. So, how do we turn things the other way around? How do we begin to use these healthcare policies to take care of our patients, to achieve collaboration instead of division?
ah, it's going to take like I don't even know how the long years it will take. Hospital fight, hospital issue. It's something that the first man that started it, even if he's dead, he needs to be woken up so that he'll come and answer this question. I'm trying to
Okay.
tell you because I don't even know the whole policy, and honestly, it's annoying trying to do, like I say, trying to do, other people's duty. Because for goodness sake, if we leave the whole hospital for pharmacists, we can't do it. I can't diagnose the patient. I don't even know what is wrong. I don't know how to run the lab test or whatsoever to get a result. Same applies to other professions. So I don't even understand the reason why we can't sit together. For goodness sake, we are all adults. I went to school for 5 years or six plus ASU strike to read a particular profession, and this is you coming to ask me to teach you so that you can chase me out of my role. And I also noticed the fact that okay, I was having a discussion with a friend, and she told me that a teaching hospital in Nigeria released the job advert, and it was only the job advert was only for doctors and nurses. So what happened to other profession? Is it that they are not needed in the hospital to be employed as well? That's the reason why we see other professions having low staffed, they are low understaffed, and the few people there are overwhelmed with duty that they even lose motivation and interest in whatever they are doing. And that is why we have so many lackadaisical people in the hospital setting. Like I've noticed it, you see someone just coming to the office to sit down, waiting for 4 o'clock to reach so that the person can carry their bag and go, because most people don't even know their roles again. I don't know my role again. I don't know whether I'm the pharmacist or I'm just there to just occupy space and all. So the whole hospital policies, or how do we even try to foster collaboration in the hospital, is something that I can't even give an answer, because it's dicey. I don't even know. I can't even give an answer of how it should go about. Because if you are speaking to this person, let's sit down and talk, and people are telling you, no, we can't sit with you. We have to do it this way. The other person, everybody is just trying to log ahead to tell you that they don't have the time for that. So I don't know how we can go about the whole hospital setting and policies to see effective collaboration. But we are praying and hoping that one man speak up or stand out to help us move the wheel while we follow.
Personally, I don't believe that we should just sit and hope and pray for change to happen. Like they say, change can actually begin with us. There's something we do in MedLabConvo, and that is emphasizing the need for personal development, soft skill development as well. Things like teamwork, commitment, leadership are core qualities that people in MedLabConvo possess or try to develop. So when Dr. Charlene was speaking earlier, she talked about employing an individualistic approach to this problem, which means that each and every one of us having this conversation right now, or that would be listening to this conversation, should actually also introspect, right? What are the skills that we can build to help us, enable us to get rid of some of this toxic mentality we already have and build a better collaborative spirit? So we can also start from our own end as individuals, and then we can try to incorporate it into our profession. And that is the place of politics, that is the place of policy making. So it is important for, I feel like we have an episode actually on Labcast. Dami, I don't know if you remember, MLS in politics. So it's important for other healthcare professionals to also put their head inside that politics. Let all of us be there so that whenever the decisions are being made, we're able to speak and come to a decision that favors everybody, a decision that is not lopsided or that is not oppressive at the end of the day. So it's important that we are not just sitting and apportioning blame, that we also recognize that we have a role to play in our different facilities and as individuals. I think we're nearing the end of this episode actually, but before we go, I feel like this has been a deep conversation, and we may still have a lot to unpack. All right, but because of our time, let's just do a this or that fun segment. So I'm just going to throw two options at you, and you choose which one is more favorable. You don't have to explain. So are we ready?
Yes.
Okay, let's do it. So night shift or day shift, Dr. Talent.
Day shift.
Answer first.
What do you mean by night shift, please?
Damn, I feel like you'll be a night shift person.
Please.
I don't mind working at night as long as I'm not stressed during the day. So, and
Yeah,
whoever is coming to take over the duty the next morning comes early. You know,
that one is important. I feel like I would prefer night shift, to be honest. Okay, the second one is, would you prefer a 5% increase in your salary for 2 months or an entire month of work?
I prefer a month off work as long as there's pay. So,
Okay. From success, have you decided?
I'm taking an entire month off work.
Okay. Okay. All right. The next one is, would you rather work with the best team but get paid less, or you work alone and get paid double?
Teamwork, please. I'd
Wait,
rather work with a team.
I work with a team.
hmm. This is a trap question, because if anybody had chosen to work alone, then I don't know what we have been discussing for the past 25 minutes or 30 minutes.
Exactly. Exactly.
I feel like everybody wants it. Okay. 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 This is interesting. This is the last one. Very interesting. Would you rather spend your entire shift with a talkative patient or a grumpy senior colleague?
Please, I'll go with a talkative patient.
Me too. A talkative patient. I could steer the conversation and then we talk about something quite interesting.
Dami, how about you?
nobody likes to be spoken down on. So, if you can control the conversation, please, I'll pick the patient. In fact, I'll tell the patient what we talk about. But a grumpy senior colleague, no way. I know a lot of them and they're very your self-esteem can be damaged. So please just that's my choice.
Honestly.
Okay guys, it was wonderful having you, Dr. Charlene and Pharmacist Success. This has been one of the most real conversations we've had on Labcast, and I hope it sparked something in you, whether frustration, motivation, or the courage to challenge the status quo in your professional space. Healthcare doesn't work in silos. The One Health approach isn't a suggestion, it is a necessity. And if we're going to make it work, we need to move beyond our ego, beyond outdated hierarchies, because we do not even know who started the problem, and start seeing each other as true partners in this fight for better health outcomes. Lest I forget, we have an episode on must have soft skills as laboratory scientists. And we feel like it's not just limited to medical laboratory scientists alone. It will go a long way if other healthcare professionals can listen to this episode on Labcast as well. To all our listeners, we'd love to hear your thoughts. Have you experienced this dynamic in your workplace? What do you think needs to change? You can drop an email at medlabconvolabcast@gmail.com or connect with us on social media at medlabconvo. You can even drop your comments while listening to our episodes on your podcast app. And of course, if you haven't already subscribed to Labcast, you're missing a lot. Stop doing that. Make sure you subscribe so you don't miss our future episodes. We're just getting started. Till next time, keep the conversations going, keep pushing for change, and most importantly, keep fighting the good fight for better healthcare. Bye bye.